Welcome! In this video, we will discuss how to decide what benefits are right for your business and your team. Disclaimer: the information contained here has been prepared by Civitas Strategies on behalf of the New Mexico Early Childhood Education and Care Department, West and Growing Up New Mexico, and is not intended to constitute legal, tax, or financial advice. The Civitas Strategies team has used reasonable efforts in collecting, preparing, and providing this information, but does not guarantee its accuracy, completeness, adequacy, or currency. The publication and distribution of this information is not intended to create and does not constitute an attorney-client or any other advisory relationship. Reproduction of this information is expressly prohibited. Only non-commercial uses of this work are permitted. Choosing whether to offer staff benefits is a hard decision. Often, cost and affordability are primary factors. When compensation is likely the number one factor in an employee's choice to enter and stay in a job, benefits are also a critical piece of their decision. Certainly, the cost of an employee benefit adds another expense to your balance sheet. However, you must not minimize the invisible cost savings of the value that benefits bring to your business. Today's conversation will explore why you should offer benefits to your employees, identify some commonly offered benefits, and discuss next steps for you in deciding to offer benefits. Now, more than ever, you may be thinking about the culture of your workplace and ways to reward and invest in your staff and attract qualified staff to your program. Benefits can be a vessel to do that in a tight job market. While benefits come with a cost, failing to offer them could also have financial consequences for your business through the loss of loyal staff, the inability to recruit employees and staff to your program, and the impact of unsatisfied employees. In this work, you will know how critical it is to attract and keep skilled staff members. The bottom line is that benefits are important and childcare businesses should aim to incorporate them whenever possible. You should be an informed consumer as you research your options and understand what's available and what questions you should be asking. Depending on your company's size and whether individual employees meet certain requirements, there may be some benefits that are legally required of you, such as workers' compensation, Family and Medical Leave Act, known as FMLA, and even medical insurance. There are also other benefits that are not required but are common amongst employers and are a critical decision-making factor when choosing a place to work. We will explore a few of the common benefits that a company can offer employees. Paid time off, or PTO, is one of the most common benefits and is widely appreciated among staff. This can include holidays, vacation, and sick days. Having the option to access PTO can improve staff's overall well-being, which can help reduce stress and burnout, especially in a job as demanding as childcare. There is no hard and fast rule on how many PTO days should be offered, and the amount of time offered can gradually increase with more time on the job. Health insurance is usually one of the first things that come to mind when someone thinks of the term benefits. It is highly sought out after employees and job candidates. Such as, if there is any one benefit worth offering to your employees, health insurance is the one to consider. In addition to medical coverage, this benefit can include dental, vision, and prescription coverage. Options within this offering range from full insurance to telehealth to discount programs. Typically, you would find a benefits provider and offer your employees certain benefits from that provider. You could cover a portion of the cost, and the employee would pay a set amount per pay period towards the cost of their plan. Alternatively, another option is to simply coordinate the health plan coverage for your staff, offering coverage without financially contributing to the employee's elected coverage. Blue Cross Blue Shield and Aetna are two private insurance companies that were frequently named by child care providers across various states when asked what companies they use. Small businesses can also help their staff sign up for the Affordable Care Act, or ACA. The ACA is a comprehensive health care reform law that provides affordable insurance for individuals. This law addresses health insurance coverage, health care costs, and preventative care. Health insurance premiums continue to decrease into 2022 and are based on family size and income. Retirement plans allow employees to build financial savings to help them meet their personal long-term financial goals. While employees who opt in will need to contribute their desired amount of salary per pay period, the benefits that are provided by these plans are individual tax savings and having the ability to receive a set amount or match to their contribution from their employer. This will allow their contributions to grow faster, setting them up for higher earnings during their retirement. Supplemental insurance programs include coverage such as short or long-term disability, accidental, and other plans to cover unexpected critical health events. Employee assistance programs are another example of supplemental insurance, which could give employees access to programs providing mental health and other well-being supports. These are typically more affordable than offering medical insurance, but they do not replace it. Staff professional development is an integral part of the childcare business model. Not only are there requirements around staff trainings, but the more knowledge your staff have in child development, the better the experience will be for the children in care. Many providers find they can provide these benefits for staff through participating in programs such as the Teach Early Childhood Scholarship Program. Offering discounted childcare to your staff's own children is a great benefit that most childcare programs find easy to implement. Not only will this benefit give staff peace of mind, but it can also help them to afford the expense of childcare, which otherwise would be a larger line item in their personal budget. The ability to receive bonuses is a benefit that many employees value, especially during these times as staff have had to work harder, longer hours, and under challenging circumstances. There's an opportunity to reward hard-working employees for this additional effort through temporary pay increases and bonuses. Visit the Financially Invest in Your Staff with Temporary Pay Increase or Bonuses resource to learn more about this benefit and structuring bonuses. First, you should decide what benefits you would like to offer. Consider your organization's budgets and goals, as well as your employees' needs. Then think through the types of benefit providers that will help you to make it a reality. Here are some benefit providers that you may come across. Private insurance providers are what we think of when we think of traditional insurance providers like Blue Cross Blue Shield or Aetna. The most common type is a group plan purchased by the employer that covers employees and possibly their family members. These plans may cost less than an individual seeking their own plan. However, they could still have a price tag that may be too costly for the average child care provider's budget. You can set how much of the cost you would cover versus the employee. You can buy these plans directly from an insurance provider, a broker, or your state's health insurance exchange. Outside of offering company-sponsored health insurance, you can still support your employees on an individual basis in assessing low-cost or free health insurance through the Affordable Care Act marketplace. You can help ensure that employees are aware of what they may qualify for and facilitate a connection for them to work with a free healthcare navigator who can walk them through their options. To learn more about affordable healthcare options, visit the resource connected with this video. Existing payroll companies and online services like Gusto, Paychex, Zenefits, and others may be helpful too. Employers may be able to purchase group insurance and supplemental plans through their payroll provider. These providers can act as a broker, streamlining the process and helping you find plans that best fit your needs. Professional employer organizations, or PEOs, offer a way to outsource the human resources function of your business, and they cover things like payroll, employee handbooks, and benefits. PEOs serve as professional employers of their clients' employees. PEOs allow for small businesses to offer benefits that are usually associated with larger companies, as they're able to leverage their large network of employees to offer more affordable rates for insurance and benefits. A shared services network or other platform for collaboration, such as the Chamber of Commerce. By participating in these networks, you can receive discounts on certain benefits through companies that partner with the network, such as medical, telehealth, dental, and vision. You could also have access to money and time-saving services like insurance brokers and enrollment specialists to guide you through the process of setting up a benefits plan. Typically, membership fees to join these networks are low to no cost. How do you determine what you can afford? Some benefits can be offered at little to no cost. Remember, there may be invisible costs that offering benefits can actually help mitigate. Costs associated with employee turnover, such as recruiting, interviewing, training, and onboarding, and vacancies in classrooms can be potentially offset by offering benefits. Talk with a child care business coach to understand just how much employee turnover is costing your business and to explore planning your budget and cash flow so you can begin to offer benefits. Let's look at these key considerations for health insurance and tax credits that can offset the cost of implementing certain benefits. When considering health insurance, know that the offerings are incredibly varied. Costs are based on number of employees covered, location, ages of employees and their dependents, and what percentage of the health insurance premium you would like to cover. You can choose a no or low cost option, which means you arrange a group insurance plan for your staff without paying any premiums. This places 100% of the plan cost upon the employee. A higher cost option would be to cover a portion of the insurance premium for your employees. Typically, this portion begins at 50%. This places the remaining portion of the plan cost upon the employee. Employees can add family members to the plan at their own expense. And the highest cost option for you as the employer is to cover a portion of the insurance premium for the employee, plus dependents. Typically, this is a spouse and or children. Small businesses can benefit from a tax credit that will reimburse you for half of your contributions toward your employees' premiums, as long as you cover at least 50% or more per employee. There are other guidelines that you must meet, which in most cases, a typical small to mid-sized child care business would. For example, if an employee's monthly premium is $235 and you pay 50% of that, you would be eligible for a tax credit of $58.75. Even though the annual cost to you is $1,410 for this employee's benefit, you would receive back $705 when you file your tax return. To learn more about this tax-saving opportunity, visit the Small Business Healthcare Tax Credit website. On this website, they give an example of starting costs for health care insurance plans. Remember, these figures do not include dependents. If you choose to cover dependents' premiums as well, these costs will rise. Costs can be much greater than those outlined in the table based on your circumstances and selections. Small businesses that start up a retirement plan can benefit from the Setting Every Community Up for Retirement Enhancement Act, known as the Secure Act tax credit. Eligible employers may be able to claim a tax credit of up to $5,000 for 3 years for setup and administrative fees associated with starting a SEP retirement plan, simple IRA, or a 401k plan. You can learn more about this opportunity from the resources accompanying this video. Be sure to talk with your tax professional about this tax credit opportunity. Once you've thought through the criteria that an employee must meet to be eligible for benefits that your program offers, next you may think about the cost, how the benefit will be administered, monitored, and tracked within your system. As you decide which benefits to offer, here are some questions to answer. Is this benefit affordable for the long term? What will be the return on my investment? Does it fit the unique needs of my employees? Will they find value in it? If I want to increase staff retention, for example, will this benefit help? What are the total costs, including fees and time, to administer the benefit? What are the pros and cons of offering this benefit and or selecting this benefit provider? Many child care providers view offering staff benefits to improve their operations by boosting morale, decreasing staff turnover, and investing in the longevity of their most important assets, their staff. However, providing benefits can also offer financial benefits through tax deductions, credits, and time savings. Once you decide to offer benefits, be sure to document your policies and update them as they change. While you are not required to offer certain benefits, you are required to follow the benefits policies that you have set forth. We recommend updating your policies and reviewing benefit offerings at least annually. This will help you stay on top of your needs and your employees' needs as they change. Visit www.crecernm.org to find our contact information, sign up for coaching, access Crecere New Mexico provider resources, ECECD recommended tools to help you build your business, and more. All resources are available in both English and Spanish.